Hi, can you tell me your name and a little bit about your background?
Yes, my name is Dr. Kurt Hong, and I'm originally from Los Angeles. I'm currently the director of the clinical nutrition program at USC.
Excellent. It's so fascinating to sort of, hear what you have to say around nutrition and food, but also around fasting. Can you tell me a little bit more?
So I think one thing that's really, really exciting is the consumer's enthusiasm in terms of looking at food as a potential therapy for all sorts of chronic diseases, whether it's simply eating better for diabetes. But I think the one thing that's really exciting is also looking at how food can also impact longevity. And if you look at some of the research that's been done over the past 5 to 10 years, we actually now have clinical human data looking at the impact of fasting, actually not only in terms of living longer, but also cellular and tissue regeneration.
So, fasting for cellular and tissue regeneration, what amount of time do we have to fast in order to get cellular or tissue regeneration?
Interesting enough, whenever we mention that we're fasting, most patients would assume this is something that's very difficult for them to do. Most people don't realize even something as little as the first 3 to 5 days can actually already you see some metabolic benefit, not only at the cellular level, but also even things such as mobilizing the stem cells, which are really critical in terms of not only cancer prevention, but also reversing some of the immunosenescence, or what we call the immune decline process that we see with aging.
So, okay, when we're fasting after 3 to 4 days, you're saying that the stem cells are mobilized? What does that mean?
So the stem cells are actually plays a critical role in terms of making sure our tissue and our organs function properly. However, if you look at the stem cell population when we're in our 20s that's circulating in our blood, we tend to have a much higher percentage. Once we get into our 50s and 60s, that drops significantly. When somebody goes through a fasting regimen, such as a fast mimicking diet, you can actually remobilize the stem cells, which actually will allow these bone marrow cells to come out of a bone marrow back into the circulation. So it can actually get to the target organ for rejuvenation and repair.
So the benefits when you're in your 40s and 50s of fasting can help to really mobilize those amazing little stem cells.
Absolutely, and we recently just published a clinical trial paper actually earlier this year showing exactly the benefit of fasting. Something as simple as 5 days per month for 3 consecutive cycles, we saw prolonged benefit even 6 months later after completion of the study.
And when you say prolonged benefit 6 months later, if I were to fast for 5 days and I do that 3 months in a row, 6 months later, what kind of benefits are you seeing?
So the most obvious benefits, we see metabolic benefits. So at the end of the 3 months, but also at the end of the 6 month cycle, most people have lost significant amount of excess body weight, particularly from their abdominal region.
Wow.
And the one thing that's also very encouraging is even though they lost a lot of body fat, they actually did not lose any lean muscle, which is also just as important.
Okay, that's a new thing, and I just want to stop for a second. So you're saying that after 3 consecutive months of fasting for 5 days each of those months, at the end of 6 months, there's been considerable weight that's been lost sort of in the midsection,
Absolutely.
but not a loss of lean muscle mass?
If anything, based on our clinical trial, there was actually slight gain of lean muscle mass.
Is this new research? Because there's so much conflicting information out there that says, if you're fasting, then you're also losing lean muscle.
So I think what makes this regimen much different as compared to before is the specific cellular signaling pathways which we're targeting. So even though this particular fasting regimen is actually low in amino acid, low in protein, it's able to maintain the right type of signaling pathways which will allow your muscle to stay in place.
Okay, so you're talking about cellular signaling.
Correct.
Tell us a little bit more about cellular signaling.
So part of the reason why we see a lot of metabolic aberrations associated with aging is because there's a deterioration in terms of all the pathways that goes on in the cell. So what this diet is able to do is almost turning back the clock. You're able to basically allow the signaling pathway to go back to as if you were 20, even though you may be in your 50s and 60s. And remember, this is something that you can just do intermittently. This is not something you have to do all the time.
So your cells are signaling in your 40s or 50s after fasting or during fasting like they do when we're in our 20s?
Correct. So like I said, it's literally turning back the clock at not only at the cellular level, but if you actually look at basically what happened when we talk to patients who've gone through multiple of these cycles, they feel better, their energy is better, and I think what's also really exciting is not only do they drop the weight, if you look at their metabolic profiles, their cholesterol numbers, their blood pressure, and also look at their inflammation levels, they all were significantly reduced.
So many people are afraid to fast
Yes.
and scared of potential dangers, as one might say. And what would you say to those people?
Definitely fasting is not for everyone, but I think for the majority of patients, particularly those who are considered to be a higher metabolic risk, it is something that's actually very doable. Unfortunately, there are a lot of basically myth out there in terms of what goes into fasting. So we definitely want to educate the consumer in terms of what's the proper way to fast. For instance, even though you may be fasting, we still want to make sure that the patients are able to hydrate themselves properly. If they run into any problems, make sure that there's a healthcare provider they can reach out to easily. But you'll be surprised, a lot of my patients where they question themselves whether or not this is something they can do. They've been very successful. And even for our clinical trial, we had a compliance rate of close to 80%.
Wow, that's wonderful. So the clinical trial took place over 3 consecutive months, or?
Over 3 consecutive months, but what we also did is we decided to look at what happened when they go back to their regular diet to see whether or not they still maintain that metabolic benefit even 6 months later. And we still saw some of those benefits, even just after 3 cycles.
What do you think are some of the biggest things that we're doing to damage our health from a nutritional perspective in today's climate?
Well, I think if you look at how our body is wired, looking at how basically our body basically processes nutrition 10, 15,000 years ago, we will go through periods of fasting where our body will then have to develop the resistance to that stress. The unfortunate things in our society today is not an issue basically of undernutrition, it's overnutrition. It's a lot of the processed food. It's a lot of the overconsumption of the wrong type of carbs. So think of this as almost a way for your body to get a chance to reset. And the analogy sometimes I would tell a patient is, if you keep your car engine on all the time, it's a matter of time before your car engine burns on. What you need to do, you need to turn it off, let it a chance to rest, and then when you turn it back on, it actually will work well. Think of fasting as basically a way for your body to reset and rejuvenate.
Beautiful. Thank you so much. It was fascinating to learn from you, and I'm sure that everyone that's hearing what you've said about the cell signaling and fasting and how stem cells are actually able to be mobilized will be as inspired as I am.
My pleasure. And I think this is a really exciting time for fasting research. Actively, we're also looking at how fasting not only can regulate immunity, but also inflammation. So we're looking at the role of fasting in autoimmune diseases, such as basically Hashimoto's thyroid disease, looking at it for use in multiple sclerosis, in inflammatory bowel disease, and even rheumatoid arthritis. So I think over the next 10 to 15 years, we're going to really have some exciting data when it comes to human studies.
It's fascinating that you say that. For me, I've been fasting for over 20 years, and I started to fast primarily because I had such severe eczema, which is an autoimmune disorder, and I felt that it would always make the biggest difference, and it was that cumulative effect. So to see the science really starting to communicate that, and then the future of where the science is going to go, it's thrilling.
Absolutely.
Thank you so much.